Osteoarthritis is the degenerative changes that happens in knee with age. These are the degeneration of knee, erosion of the cartilage layer of knee that happens with age and due to increased weight. There are generally four stages of osteoarthritis: stage 1, 2, 3, and 4. In early stages 1 and 2, the problem of the patient is generally pain in knee joint. Medial aspect of the knee is generally more painful, and in later stages of osteoarthritis, stage 3 and 4, there is also crepitations, clicking sensations, deformity, and stiffness in knee joint. Crepitations and clicking sensations is generally the sound that you feel while folding your knee or extending your knee. These crepitations are also felt when you are climbing upstairs or downstairs or any excessive movement of the knee. Stiffness of the knee joint is generally felt when you wake up from sleeping posture, or when you change your position of knee after a long time. You feel a binding sensation or stiffing sensation in your knee joint. You are unable to extend your knee or fold your knee. That increases gradually to permanent stiffness of your knee in a particular position. Gradually, the clicking sensations is added with pain. You are feeling pain with sound of your knee joint during movement. In general walking, you feel severe pain on the medial side and the posterior part of the knee. There is swelling in the posterior part of the knee that extends from thigh to ankle region. And these type of pain gradually increases with time, leading to deformity of your knee joint. Your knee joint is generally bent inward, and there is difficulty, a lot of difficulty during walking. Osteoarthritis causes generally include age. Degenerative changes gradually accumulate with age. As I have mentioned earlier, that these are daily wear and tear of our body accumulates with age to cause a gradual erosion of cartilage layer of knee joint. So when the patient ages, his body ages, his joints also ages. So the main joint that bears all the weight are hip, knee, and ankle joints. And in these major joints, due to the arthropometric problem of different joints, knee joint is the first to be included, followed by hip joint and ankle joint. In basic, we can say that age is the major factor, followed by the weight of the patient, and many other genetic and hereditary factors are also included, but the major factors are age and weight of the patient. Diagnosis of osteoarthritis is basically done by X-ray of the knee joint in standing position. Standing position is important because we look the joint space reduction as per the weight of the patient. When the weight of the patient is applied, how much joint fluid reduction is there, joint space reduction is there, that is used to diagnose the grade of osteoarthritis. Osteoarthritis is degeneration of weight-bearing joints. These happen with age, with degenerative changes that are happening in your body. Rheumatoid arthritis is altogether different thing. It is a blood-borne disease. It is an hereditary disease that is due to mainly rheumatoid factor. Your doctor will get a checkup of RA factor or anti-CCP antibody factor in your blood. If it is increased, you will feel pain and stiffness in your fingers. Rheumatoid arthritis starts with fingers. Small joints of hand and foot are involved first. There will be deformity, swelling in your joints of fingers. Whereas osteoarthritis starts with knee. Osteoarthritis involves major joint of body like knee and hip. And most common involvement in osteoarthritis is knee joint. There will be swelling in knee, stiffness in knee, and it will be gradually increases with age. The age group of osteoarthritis is generally 55 and above. Whereas in rheumatoid arthritis can start at early age also, and it involves fingers, small joints, and is specifically associated with morning stiffness. In morning, when you wake up, you'll feel stiffness in your hand, and you'll be unable to move your hand, make a fist, and things like that. First and foremost, the complications that are clicking sensations, difficulty to walk, deformity of the knee joint, and osteophyte formation. Osteophytes are the small bony particles that are formed on the medial and lateral part of the knee. These bony formations do the problem that they are very promoting to the clicking sensations of the knee joint. Due to these bony prominences, there is constant pain on your medial side of the knee. These changes the shape of the knee and gradually progress to the deformity in the knee joint. Treatment of osteoarthritis depends on the grading of osteoarthritis. In early stages of there are four stages of osteoarthritis. In early stage, like stage 1 and 2, we offer conservative management. Along with that, there are few PRP injections, hyaluronic acid injections, steroid injections that are to be offered to the patient. We advise the patient to have physiotherapy, knee exercises to build up the muscles around the knee joint so that the pain is reduced. Apart from that, we advise second stage, if the patient pain is not relieved by that, second option we give intra-articular injection, knee injection. There are some injections containing the liquid of knee joint artificially prepared to be injected into the knee joint. These are hyaluronic acid injections. Those increase the fluid activity of knee joint. Other option, intra-articular injection, is PRP injection. PRP injections are something that is acquired from your blood only. These are concentrated platelet-rich plasma. So platelet-rich plasma are injected into the knee joint. These promote self-healing of the arthritis parts of the knee joint. Other third option is intra-articular injections. Intra-articular injections are something that decrease the inflammation of knee joint. So the swelling of the knee joint, the synovial tissue that is inflamed in the knee joint are reduced. That will relieve the pain. Apart from that, some knee braces are advised that are offloader knee braces that decrease the weight bearing of knee joint from medial compartment and shift that weight to lateral compartment. These are for stage 1 and stage 2 of osteoarthritis. In stage 3 and stage 4, we go ahead with some surgeries are done to correct the weight bearing mechanism of knee joints. Those surgeries are known as STO, high tibial osteotomy. If the patient's age is on a lesser side, such as 45 to 50 or 50 to 55 years age, patient is having grade 3 arthritis and the weight bearing axis of the knee joint is shifted to medial side. So in that stage, we can offer high tibial osteotomy. That is a surgery to correct the deformity or abnormal weight bearing axis of knee joint. If the patient's age is above 55, he is having severe arthritis stage 3 or stage 4 with deformity, severe pain, the option that we can offer is total knee replacement. In that, we change the diseased part of the knee, just the surface of the knee that are eroded, and change it with metal implants that are cobalt chromium implants. There is one more option that is gold knee, that is the most advanced knee that offers pain relief also with control in infection, and that is have good prognosis after the surgery. Those are do more and more exercises that are advised by your doctor. These exercises include quadriceps strengthening exercises. The front muscles of your thigh are quadriceps muscles. So strengthening of that muscles include quadriceps strengthening exercises. The medial part of the thigh muscles are VMO muscles. So VMO strengthening exercises. And posterior part of thigh muscles are hamstring muscles. So we have to strengthen anterior part and medial part via quadriceps strengthening, VMO strengthening, and we have to stretch the posterior part of the thigh, that is hamstring stretching exercises. These will be guided by your physiotherapist. We have to strengthen anterior medial muscles and we have to stretch posterior muscles. These are the do's. We have to advise the patient to do regular stretching of all the other muscles of the body. You have to control your weight, do a morning yoga, morning walking is very necessary, but not jogging. Morning walking, brisk walking is advised in these patients, but they don't have to jog because jogging does extra jerk to the knee. And don'ts are, we advise the patient not to squat. In squatting, any ground level activities like sitting on the ground with folded knee or squatting or standing up from squatting position, these are not to be advised in the patients with severe osteoarthritis. There are many ways to prevent osteoarthritis in patients, those who are having family history of osteoarthritis. from early age. If we have to prevent osteoarthritis, we have to start from early age, like 35 to 40 years age only. We have to advise them about precautions, what not to do, how much they have to concentrate on weight reduction. First and foremost thing starts with control of weight. They have to do exercises of thigh muscles, specifically thigh muscles, anterior and medial part. Strengthening is have to be done by them. There are some natural ingredients that are beneficial for the patient to prevent osteoarthritis, like aloe vera juice and some cartilaginous. If the patient is taking non-veg, cartilaginous part of the meat is beneficial for the patient. These prevent the osteoarthritis. A proper way to walk, proper exercise, morning exercise, proper routine, proper lifestyle modification will obviously help the patient to prevent from osteoarthritis, even if he is having a genetic history or familial history.